Monkeypox, a viral disease, has garnered significant attention in recent years. This attention is due to its potential to cause outbreaks and the need for effective public health responses. The disease, though not new, has seen a resurgence in various parts of the world, prompting renewed interest and research. First discovered in 1958 among laboratory monkeys, the virus responsible is a close relative of the smallpox virus. The initial discovery was somewhat serendipitous, as scientists were studying other diseases when they stumbled upon this new virus. The name monkeypox was derived from the first identified cases in monkeys, but it is important to note that the virus can infect a variety of animals, including rodents. Human cases were initially identified in 1970 in Central and West Africa, where the disease is primarily found in rainforest regions. These regions provide a natural habitat for the virus, which is maintained in the wild through a complex cycle involving various animal hosts. The first human cases were linked to direct contact with infected animals, highlighting the zoonotic nature of the disease. While monkeypox is considered less transmissible and less severe than smallpox, understanding its characteristics, transmission, and preventive measures is crucial for public health. The symptoms of monkeypox are similar to those of smallpox, but generally milder, including fever, rash, and swollen lymph nodes. However, complications can arise, especially in individuals with weakened immune systems. Public health efforts focus on surveillance, early detection, and vaccination strategies to prevent outbreaks. The global health community continues to monitor the situation closely, ensuring that measures are in place to mitigate the impact of this re-emerging disease. Monkeypox belongs to the orthopox virus genus, which includes the variola virus, also known as smallpox, the vaccinia virus, which is used in the smallpox vaccine, and the cowpox virus. It is a zoonotic disease, meaning it can transmit from animals to humans. The virus resides in certain animal populations, primarily rodents in parts of Africa. Monkeypox transmission occurs through close contact with infected animals or humans. Contact with infected animals can happen through bites, scratches, or handling of their bodily fluids. Human-to-human transmission primarily occurs through respiratory droplets during prolonged face-to-face contact, direct contact with bodily fluids or lesions of an infected person, or contact with contaminated materials like clothing or bedding. The incubation period for monkeypox typically ranges from 6 to 13 days, but can extend up to 21 days. Initial symptoms often resemble flu-like illness, including fever, headache, muscle aches, back pain, chills, and fatigue. Swollen lymph nodes, a distinctive feature of monkeypox, differentiate it from similar illnesses like chickenpox or measles. Unmistakable mark the monkeypox rash. Within 1 to 3 days of fever onset, a rash typically appears. It often starts on the face and spreads to other body parts, including the palms of the hands and soles of the feet. The rash progresses through distinct stages, evolving from flat red spots called macules to raised bumps known as papules, fluid-filled blisters termed vesicles, and finally, pus-filled pustules that crust over and fall off. Seeking confirmation. Diagnosing monkeypox. Diagnosing monkeypox involves a combination of clinical evaluation and laboratory testing. Healthcare providers consider the patient's symptoms, travel history, and potential exposure to infected animals or individuals. Laboratory confirmation relies on detecting the virus's genetic material, or DNA, in samples taken from skin lesions. Navigating the illness treatment and management. While no specific treatment exists for monkeypox, most cases resolve on their own within 2 to 4 weeks. Supportive care focuses on alleviating symptoms like fever, pain, and itching. Antiviral medications developed for smallpox may be used in severe cases or for individuals at higher risk of complications. Shielding yourself preventive measures against monkeypox. Monkeypox is a viral zoonotic disease, meaning it can be transmitted from animals to humans. Understanding and implementing preventive measures is essential to protect yourself and others from this disease. Preventing monkeypox primarily involves avoiding contact with infected animals or humans and practicing good hygiene. This includes washing your hands regularly with soap and water, especially after handling animals or being in areas where animals are present. Using hand sanitizer with at least 60% alcohol can also be effective when soap and water are not available. Reducing the risk of animal-to-human transmission in endemic areas includes avoiding contact with sick or dead animals, particularly rodents. Rodents are known carriers of the monkeypox virus, so it's crucial to steer clear of them. If you must handle animals, wear protective gear such as gloves and masks to minimize the risk of transmission. For human-to-human transmission, practicing good hand hygiene through frequent hand washing with soap and water or using alcohol-based hand sanitizers is crucial. Proper hand washing techniques involve scrubbing all parts of your hands, including the backs, between your fingers and under your nails for at least 20 seconds. This simple yet effective practice can significantly reduce the spread of the virus. Avoid close contact with individuals exhibiting monkeypox symptoms such as fever, rash, and swollen lymph nodes. Refrain from sharing personal items like utensils, bedding, or towels with others, as these can be sources of contamination. Disinfecting personal items and surfaces regularly can also help prevent the spread of the virus. By following these preventive measures, you can protect yourself and contribute to the overall effort to control the spread of monkeypox. The power of prevention vaccines and their role. Vaccines have been one of the most significant advancements in public health, saving millions of lives and preventing countless diseases. They work by stimulating the body's immune system to recognize and fight pathogens, such as viruses or bacteria, without causing the disease itself. This proactive approach to health has been instrumental in controlling and even eradicating some of the world's most dangerous diseases. Vaccines, particularly those developed for smallpox, have shown to be effective in preventing monkeypox. The smallpox vaccine, which was a groundbreaking development in the 20th century, not only helped eradicate smallpox, but also provided cross-protection against related viruses like monkeypox. This cross-protection is due to the similarities between the smallpox and monkeypox viruses, allowing the immune system to recognize and combat both. While routine smallpox vaccination was discontinued in most countries after its eradication in 1980, some individuals may have received the vaccine, offering them some level of cross-protection against monkeypox. This historical achievement of eradicating smallpox stands as a testament to the power of vaccines. The cessation of routine smallpox vaccination was a milestone, marking the end of a deadly disease that had plagued humanity for centuries. However, the legacy of the smallpox vaccine continues to provide benefits, as those who were vaccinated still retain some immunity against related viruses. Vaccination efforts are being implemented in some regions experiencing outbreaks or for individuals at higher risk of exposure, such as healthcare workers or laboratory personnel handling the virus. These targeted vaccination campaigns are crucial in controlling the spread of monkeypox and protecting those on the front lines. By vaccinating healthcare workers and others at high risk, we can create a buffer of immunity that helps prevent further transmission of the virus. This strategy not only protects individuals, but also helps safeguard public health on a larger scale. Staying informed, staying safe public health recommendations. Staying informed about monkeypox is paramount in curbing its spread. Reliable sources like the World Health Organization and the Centers for Disease Control and Prevention provide up-to-date information, travel advisories, and public health recommendations. Following these guidelines, including reporting suspected cases to healthcare providers and adhering to isolation or quarantine measures if required, is essential in protecting yourself and others. Conclusion. Your health, your responsibility. Monkeypox, while a public health concern, is a preventable disease. Understanding its transmission routes, recognizing its symptoms, and adopting preventive measures are crucial steps in safeguarding personal and community health. Staying informed about the latest developments and adhering to public health guidelines empower individuals to make informed decisions and contribute to the collective effort in controlling the spread of monkeypox.